Well, welcome to this update. It's Sunday the 15th of August today. Now, I want to focus today on the new therapy in the United States, this monoclonal antibody therapy that seems to be being, let's just say it seems to be being promoted, and we'll look at what that is probably about. Now, before we do that, though, let's just do a bit of orientation and some basic updates from the United States, Australia and the UK. So these are the situations and the new cases. So Australia, Barbados, Canada, cases going up but low. Japan, it looks like the cases in Japan are going up, but it looks like they're lowish. But in actual fact, in Japan, for some strange reason, they're hardly testing at all. Ireland, the United States, both going up still, and the United Kingdom has been going down, but now going up again. How reliable is that from the testing point of view? Well, the United States is actually testing more than this indicates for various reporting reasons. Ireland don't seem to have been reporting testing data for some weeks, actually. I'm not quite sure what's going on there. But Australia and the UK testing fairly well. In terms of fully vaccinated, Australia, 'tis picking up. Barbados, reasonably good. Japan, picking up after a very low start in Japan. So a very low start in vaccination, very low testing rate, rather poor response really for a sophisticated country like Japan. Vaccination rates in the UK, in the United States, levelling off, but there are grounds for optimism that we'll see in a minute. United Kingdom, Ireland and Canada. So this high vaccination rate in Ireland should be enough to contain the increasing cases that we are seeing in Ireland at the moment. Just a few other countries to look at: Cambodia, Vietnam, Philippines. Difficult to ascertain exactly what's going on because of the low levels of testing. Thailand and Malaysia cases are still relatively high and increasing in Thailand. There's the testing there. So Malaysia, it's pretty good. Cambodia's just increased its testing. Vietnam's working on it. Thailand, the data's a bit out of date. Philippines, low levels of testing. So Philippines probably has significantly more cases. And when we look at the vaccination rates there, Vietnam very low, Thailand picking up, Philippines, Malaysia. Cambodia has done well with a lot of Chinese vaccines that have been donated directly from China to Cambodia, which is why there's more fully vaccinated people in Cambodia at the moment. So I thought that was a bit of interesting orientation. Now let's go on and look at the United Kingdom next. Now this is some interesting information from the Office for National Statistics that I wanted to show you. This is willingness to accept childhood vaccinations by parents. So this is primary, so this is age 5 to 10 or 11. This is secondary, aged 11 to 17 or 18. So interesting, yes, definitely. Under 40% in primaries, but over 50% in secondaries, so that's interesting. Parents that will probably say yes after they've thought about it. So we see the yes definitely and probably yes are the vast majority. Unsure but probably no, and definitely no, relatively small numbers. So it looks like quite high degrees of vaccine acceptance in the UK. Now, these are deaths involving COVID-19 that I just wanted to bring you up to date on as well from the Office for National Statistics. Always a bit of a delay, of course, week ending the 30th of July. But we are seeing more deaths in green there. So blue is deaths not involving COVID-19. Green, deaths involving COVID-19. So a slight increase, as we had really expected, to be fair. Now, 3 ways to measure death in the UK, and this is quite interesting. Which one are we going to go with? So let's just look at that now. So deaths within 28 days of a positive test, so 131,000 almost there. Death certificates mentioning COVID-19, 154,000. But of course, we've had essentially no influenza over the last influenza season. And a lot of these people that have died of COVID would have died of influenza. So I actually think, I don't know what you think about this, let me know. But I think this is probably the most accurate level of the number of people that have died. Of course, well, these people have died who would have died anyway, is what I'm trying to say. So 118,000 deaths over and above the usual number since the outbreak began. So, of course, in a normal season, people would have died of influenza rather than dying of COVID. So how many people have died from the pandemic? Well, yes, of course, this is the number after 28 days of testing. This is the number where it's mentioned on the death certificate. But the actual number of people who aren't alive who otherwise would have been is probably nearer this figure here, 120,000 in the UK. Now, people are arguing about this all the time, and basically you can have your own opinion on that because there's not really any absolutes on that. So I won't say further on it actually. So United Kingdom, let's just look at some of the statistics going on here. Vaccination programme is going more slowly. Now, cases in the United Kingdom, this is for the UK as a whole, we see there is somewhat of an increase, which of course we had expected. But what we've got to look at is the healthcare. How is this impacting hospitalisations? And we see that it's still reasonably high, 880 people in the last 24 hours hospitalised. But it's not going up. So they're the number of new admissions. That's roughly level. And the number of people actually in hospital is actually going down slightly. So that is, well, I think basically that is encouraging. It's kind of what we had expected and what the government was prepared to tolerate. I think that's probably fair to say. So that was the links from the UK there. That was the official government site, and that's the ONS site there to peruse for yourself. Now, the United States, we are seeing a very patchy situation in the States. So, for example, just picking up on one news report, Baton Rouge, Louisiana, patients have been refused entry to intensive care. And on that video there, the relevant doctors are talking about that. So some areas, definitely quite a big problem. Other areas, much more manageable in the States. Now, I want to show you some, again, these are direct feeds from the States. So here we have new cases for all of the United States. But if we look at states that did have lower vaccination records, we pick one particular state, for example. What should we go for? Let's go for Mississippi. If that's going to work, yeah. Now we see the cases there have risen sharply. That number there is actually over 5,000 for the day. So we are seeing sharp increases in some states. This is a patchy situation. And if we look at trends in the numbers of COVID-19 vaccines in the US, again, this is encouraging. We see that the Delta variant pandemic has encouraged a lot of people to get vaccinated. And what has been particularly encouraging, again, if we look at particular states, now I haven't actually selected one particularly here, but I don't know, let's look at Louisiana that we mentioned. What are we seeing? Well, yeah, we are seeing quite a substantial increase in vaccinations. If you could see it, we would see it. There you go. So we are seeing quite a substantial increase in vaccinations in Louisiana, for example. Maybe look at one more state. Let's look at Mississippi again. What are we seeing there? Yeah, again, we see vaccinations are increasing. Daily count of total doses administered and reported to the CDC in Mississippi. So we see this is increasing. So I just found it very encouraging that people in these states that were under-vaccinated, I wouldn't say they're catching up yet, but certainly heading in the right direction. But as we've seen in the Baton Rouge situation, overall hospitalisations in the States are going up really quite sharply, and this is causing problems in some areas. And because of the increase in cases and the relatively low vaccination rates, we are going to see hospitalisations going up. Because, of course, the increase in the vaccination status is not going to kick in for some time because the immunity won't kick in for some time. So that was that sort of quick appraisal of the United States. Australia, New South Wales, of course, is the big problem. An extra 415 locally acquired cases in the past 24 hours in New South Wales. 273 cases under investigation, so they're not quite sure where they came from. Locally acquired cases reported since the 16th of June. There's 7,745 cases reported in this outbreak since the 16th of June. Again, this is just for New South Wales. Deaths has been another 4 in the past 24 hours. That equals 48 in this outbreak. 104 for the entire pandemic in New South Wales. These are the hospitalisations, still going up. 361 in hospital, 62 in intensive care, 24 being ventilated. These figures actually haven't increased much in the last couple of days, so that is encouraging. New restrictions for all of New South Wales, and this is concerning. Sewage surveillance programs have indicated that the virus is present in sewage in areas around about Sydney where no cases have been officially diagnosed in the human beings, the living human beings. It's just been detected in the sewage, but that does indicate there's probably some community transmission in these other areas of New South Wales. So more cases to come, and it's not looking too good really in terms of eradication as has happened in previous outbreaks in Australia, and that's not too surprising because we are dealing with the Delta variant now. Now, I want to talk about monoclonal antibodies now. Now, let's just give a bit of background here. So, when you're exposed to the virus itself, that's the antigen. The body responds, the immune system responds by making the antibodies and, of course, stimulating other immune cells. But we can actually culture cells in the laboratory that will produce monoclonal antibodies. Monoclonal antibodies means all the antibodies are the same. And we can make antibodies that specifically fight the spike protein. So these are antibodies that are made in the laboratory, then injected, usually by infusion, into the individual. So the individual gets the immunity from the antibodies without making the antibodies themselves. Now, if you make the antibodies yourself, that's called active immunity. If you get antibodies from an outside source, that is passive immunity, but you still have immunity. And that will last for, I don't really know how long, probably a month or two. The antibodies will probably survive in the blood for a month or two, or possibly 3, that sort of time range. We know that because babies have antibodies from their mothers that persist for several months after birth. So this idea of passive immunity. Now, this passive immunity will not stimulate the memory cells. It will not stimulate the memory B, the memory T cells, and the other components like the natural killer T cells of the immune system. It won't stimulate those. So this is a short-lived thing. So the idea here is that you give this when you first know someone's infected and it stops them deteriorating, because the antibodies that you give go and beat up all the viruses, get rid of the virus, and the person doesn't deteriorate. And because you've got rid of the virus, you don't have the inflammatory reaction in the body to the virus. Therefore, hopefully you don't get the fluid collecting in the alveoli and the acute airway problems. That's the idea, and it makes perfect sense. And of course, this therapy became quite famous when a certain president of the United States became infected. Can't remember his name now. Might have been President Trump. In fact, of course, it was President Trump. And he made a very good recovery. Probably partly because of that, in fact, because he did have other risk factors such as age and probably slightly more adiposity than would be ideal. Now, let's look at this. Now, we have to understand, to understand this, we have to understand that it's a phased illness. This is a phased illness. Now, we reported on people giving monoclonal antibodies way back, a year ago now, and they didn't do very well because they were given to people who were already in hospital. Now, people that have already been in hospital have probably been diagnosed for a week or more, so they're not suffering so much from the virus itself, but from the body's immunological inflammatory reaction to the virus. Now, in that immunological reaction to the virus, that's when we have to give steroids to dampen the immunity down. Before that, there's scope for antivirals, and that's when this comes in. So it has to be given early. If it's given late, you wouldn't expect it to be effective. Now, this is the Paul Merrick FLCCC Frontline Critical Care Alliance protocol. Now, of course, they put disclaimers before you even get to this page that this is for educational purposes only. They are not advocating treatment, and of course I never advocate treatment, so this is for educational purposes only. But it is interesting education. So this is the Math Plus protocol that's quite well known from the Frontline COVID-19 Critical Care Alliance group. Paul Merrick himself, of course, a very well-known doctor. So what I wanted to show you here was the phased nature of the illness. Now, what we see here is, so they're having actually day one as when someone is getting, when someone's first infected. The incubation period is their day one. So fair enough, that's when, well, oh dear, what's happened here? Sorry about this. We've now gone to the bottom of their protocol for some reason. Let's go back to the appropriate page. There we go. Right. Actually, that does show you that there's lots there to read, packed full of interesting reading on their website. There we go. Right. So person becomes infected there, increasing the number of viruses. So this is the time here when the monoclonal antibody would work, because the monoclonal antibody works against the virus. But by the time people get into the later stages, where they're getting this delayed innate immune inflammatory response, immune dysregulation, the virus is actually already gone. Now, there will be viral debris there, so people can still test positive on the PCR test during this time, for example, but there won't be live replicating virus. So it's very important to realise it has to be given in that particular time frame. Now, there's various other protocols talked about here on the FLCC site. I'm not going to talk about the antiviral therapies they recommend, even though there is interesting discussions to be had around that topic. But the point is, the antiviral therapies that are currently postulated are not going to be rolled out widespread. It's just not going to happen, unfortunately. Any more than people are going to change their mind and governments are going to start advising their clinicians to aspirate before they inject their vaccines. These seem to be just huge areas that don't seem to be addressed by governments, unfortunately. But that just shows the phased nature of the illness. So getting back to the topic, the monoclonal antibodies. Now, this is the Regeneron treatment. Now, so having said it's monoclonal, they actually give two different monoclonal antibodies. They call it a cocktail, but it's only two, so it's two different ones. So this is a report from Florida, but it's also being used in Mississippi and other states, we believe, at the moment. So this seems to be getting promoted. So Florida, there's mobile clinics already in operation that will give this monoclonal antibody, give the monoclonal antibodies almost on an outpatient type basis. What seems to be happening is they're given an infusion, kept an eye on for, I would assume, quite a few hours after to make sure they don't have a reaction, and then basically sent home. And if that's given in that early stage of the illness, when the virus is still prevalent and replicating, before the virus has had time to trigger the immunological response, that should prevent the patients from deteriorating. The theory is good and there is evidence for this. So that's what's happening. Governor DeSantis in Florida seems to be a keen advocate of this. A direct quote from him: the most effective treatment that we've yet encountered for people who are actually infected is correct. This is people who are actually infected, and I would add acutely infected with COVID-19. And he said it's the best shot we've got right now to keep people out of hospital and keep them safe. Now, having said that, he doesn't seem very keen on mask mandates and other restrictions, but that's a direct quote from what he says. Now, this is a treatment. Personally, I prefer to prevent disease rather than treating it. I prefer not to be ill in the first place, but I'm just reporting what he's saying. But the science behind the treatment he's advocating does make sense for people that are already infected. It does make sense. He's claiming 70% reductions in hospitalisations. Well, this is going to depend very much on who you give it to, I would have thought. If you give it to young fit people, they're probably not going to be hospitalised anyway. But if you give it to people who've got comorbidities and are older, then yeah, you could reduce hospitalisations. So I'm not sure that figure means too much, but it must be based on some sort of data. So it can reduce hospitalizations. We know it can prevent people deteriorating. But what about the supply of this? Because really what we can't do is give everyone who's diagnosed with a positive test monoclonal antibodies. We'd have to pick the people that are at particular risk of deteriorating and thereby keep them out of hospital. That is the governor's thinking in this, as far as I can ascertain. Trump administration initially bought 300,000 doses at $1,500 per dose. This is a lot of money. Federal government's now bought 1.5 million doses, and they say they're going to make it free to patients, which of course is good. So DeSantis' idea: urge people at high risk to get the treatment at the first sign of symptoms. Now that does actually make quite a lot of sense, and a direct quote from the governor says it's going to become part of standard care. As far as I can tell, Regeneron, who make this, tell me if this is wrong, but I think that's their sales for the quarter, for 3 months, 2.59 billion dollars. Now, how would this compare in cost to wearing masks and social distancing? Well, wearing masks is pretty cheap. $2.59 billion in sales sounds like a lot of money to me. The other reason I'm slightly concerned about this, of course, is this not going to help much in Africa at all, is it? They're not going to have these treatments in Africa. But what he's saying is, if people already have it, okay, we could argue that they shouldn't have had it already, but if they have it already, if they haven't taken the vaccine, if they haven't socially distanced, if they haven't been mask wearing and they've got the infection, if they've got it already, they are symptomatic, they are in a high risk group, then giving this treatment in the early symptomatic stage, and I stress it's got to be the early symptomatic stage, I would fully expect that to reduce hospitalizations. So that bit makes perfect sense. Kamai Kim, Division of Infectious Diseases, University of South Florida. The number one strategy is probably going back to social distancing again and wearing masks. Well, I think there's political problems around that. And obviously, Governor DeSantis has his view on that, which most public health people would not entirely agree with, which I guess is true. I like to keep things simple. And, treatments that are very expensive need to be given intravenously. Okay, if we were sick, in high risk group, that would be a good idea. I'd want that. But if you could prevent it, that would be better still, wouldn't it? Or if there was an antiviral drug that was dirt cheap that people could take at home, that would be good as well, rather than a drug that was for 5 cents a course, 5 cents a tablet, rather than $1,500 a shot. Having said that, we don't know how much this latest batch was. That $1,500 was the price that was worked out for the initial Trump administration, 300,000 doses. Anyway, I think you get my feelings on both sides of that. So I think we'll probably leave that there. It's not a straightforward subject by any means. Now, I think we'll finish off with a report from Africa now, from Wufafa. So over to you, Wufafa. And there was a slight concern. There's actually been a slight increase in the cases of Marburg virus that Wufafa is going to partly tell us about, as well as the COVID-19 pandemic, since he reported this. But let's let him speak for himself. Thank you, Wufafa. Over to you.
Hello everyone, welcome to our channel. This is Wefafa Andrew, and I'm here to give you some COVID-19 updates for Africa, and then I will also talk about South Africa, since it is the one that is having the highest number of cases in the whole continent. And I will also summarize by talking about the COVID-19 situation in Uganda, where I'm reporting from. Before I talk about the COVID-19 situation in Africa, allow me to briefly talk about the Marburg outbreak that occurred something like 4 days ago in one of the African countries in West Africa. and that is none other than Guinea, where they reported their first case. I think it is something like 4 to 5 days ago. Now, this virus was detected in one person, but as we talk, there are about 150 people who have been found having this Marburg virus. Now, Marburg virus is one of the viruses that cause hemorrhagic fever, and it is in the same family with other dangerous viruses like Ebola. About 2 months ago, this country declared a victory over Ebola virus. That means it was totally eradicated from the country, but just something like 4 days ago, another hemorrhagic fever causing virus was also detected in that very country, and it is the first time this virus has been detected in that country, and also it is the first time, or it is the first place or country where this virus has been detected in the whole of West Africa. Now, Marburg virus, as I said, it is in the same family with Ebola, and it has the same signs and symptoms, and then it also has the same mode of transmission. Now, this virus is believed to be transmitted from animals to man or humans, and the animals that host this virus are a certain species of bats. But research, I think it is still undergoing to find out what is its real natural host. But this virus, when someone has it, it takes about 5 days for someone to show the signs and symptoms. And one of the signs and symptoms is vomiting blood, diarrheating blood, having stomach ache, and then headache. So those are some of the updates that I got for you, my viewers. And now let's go back to COVID-19. In Africa, the COVID-19 situation is not very good. As I talk, the cases are still increasing. Africa has recorded a cumulative number of above 7.1 million cases, with a cumulative number of over 6.2 million recoveries. The recovery rate is good, but the cases are still increasing. And we have recorded a cumulative number of about 180,000 deaths. So that is the general overview. With the COVID-19 vaccine situation in Africa, yes, we are still not doing well as far as COVID-19 vaccination is concerned, but the situation is improving because, as I mentioned last week, the 400 million doses of Johnson & Johnson vaccines that were acquired by the Harvard are being distributed. Also, Guinea-Bissau acquired, I think, some good numbers of vaccines from USA via the COVAX, and these vaccines that they have received is believed to raise the coverage of the vaccination to about 16% of the target that the country has set to be vaccinated. Now, my good people, allow me take a look at South Africa, which is the country that is leading in cases as far as Africa is concerned. The general situation in South Africa is not very good. They reported, I think it was yesterday, a lot of cases in a single day. Let me see if I can be able to get the exact number. I've not been able to get the exact number they got on that day, but the cumulative number of cases is around 2,568,511. So that is the cumulative number. And then the cumulative number of deaths is about 76,243. 7. When you look at the recoveries, they have reported around 2,344,896 cases, and this gives us a total of around 91.3% recovery rate. I've not gotten the data on the vaccination rates in South Africa, but as soon as I get it, I will be able to update you. Also, if you're watching from South Africa or any other country where they're giving COVID-19 updates, tell us about the COVID-19 situation in your country or in your area where you're living. Let us know such that we can fight this together. Now let's take a look at the general situation of COVID-19 in Uganda, a country where I'm reporting from. I can say that the general situation has been good, though I have realized that now there is a gradual increase in the number of cases after the lockdown was relaxed something like 2 weeks ago. I will go through the statistics that we have as per today. Uganda has performed a total of 1,515,178 tests, out of which we have a cumulative number of 96,497 cases. And then we also have a cumulative number of 94,039 cases. And this gives us a positive rate of around 6.7. Comparing with the previous one, it has slightly increased because the previous one were in the range of 4 to 5. But now it has increased given the fact that the lockdown measures were relaxed. So now a border can carry a passenger, and many people were allowed to go back to work. I think that could be the cause, but it is important because people, if are not working, it is difficult for them to maintain themselves. So yeah, I think even when the positive rate has increased slightly, yeah, it is still better than before the lockdown. Yeah, I think this is because people out there, they are now serious about COVID-19. In fact, these days you meet many people with masks compared to the time even when the virus had just started. So people have now learned about the virus, they know it kills, and they are following all the recommended guidelines that can keep us safe. So I want to thank them for that. Uganda has reported a total of 2,856 deaths, including 24 new deaths, and we have a total of 1,167,733 doses of vaccines administered. We have a target of administering 22 million, so this is still low, and majority of people who have received the vaccines have received the first dose. But the good news is at least they imported some vaccines, and in areas of the capital city of Uganda, that is Kampala, they have resumed the vaccination exercise again. In Bale, where I'm staying, they have not yet resumed the exercise, but hopefully very soon they will. Allow me finalize by talking about the treatment in Uganda. For asymptomatic cases, we manage them from home using diet. We recommend that is rich in vitamins, most especially the vegetables, the green ones. And then we also tell people to increase the intake of fruits, and we recommend that they also eat other foods that have some anti-inflammatory actions or functions like ginger and others. And then we also recommend a minimum of 20 minutes daily sun bathing. We also give some people tablets of vitamin C if we know that they will not have access to those fruits and other foods that we recommend. And then those ones who are symptomatic, they are managed from hospital, where we put them on some antibiotics like azithromycin, some anti-inflammatories like dexamethasone, and then we also put some people on oxygen in case they're having difficulties in breathing. So ivermectin, they rarely use it in Uganda because it is not on the guidelines. Since I've been in the community busy, I've not had a chance of interacting with patients of COVID-19, but as soon as I meet one, I will use ivermectin and I see how it works. So that is all for today. Now, thank you very much, friends, for watching today's update. Hope you found this video important. Let me know in the comment section. And if you've not subscribed, I request that you consider subscribing by clicking that red subscribe.
Great, thanks, Fafa. Of course, Fafa's talking about his own channel there, so I will put I'll put the links to that so you can go and look at his channel. Lots of good community health stuff there. 2% vaccination rates. Yeah, well, not much comment required on that, really, is there? So thanks for that report, Fafa. Great to know what's going on in Africa. Let's hope that Marburg situation is contained just as the Ebola situation was, because we don't want that as well as COVID-19. So thank you for that, and thank you for watching.